On this series on understanding and correcting your lab markers, we're going to focus on iron deficiency. There are two ways to measure iron. The first would be to look at hemoglobin. Hemoglobin is the oxygen-carrying component of your red blood cell. Hemoglobin is made predominantly in the bone marrow, and then it does get recycled by both the spleen and the liver. It does measure the amount of oxygen that's being carried from the lung to the tissue. The other way to assess for iron would be in the form of ferritin, which reflects iron storage. Ferritin is predominantly stored in the liver, but it also to some extent is stored in the muscle. Common symptoms of low iron that I see in my patients are low energy and shortness of breath. But I do find as the iron deficiency progresses, patients do start to experience more anxiety and even to some extent hair loss. Typically when I'm looking at a blood panel, I'll look at hemoglobin. I do like the levels to be at 130 or higher, and patients who are below 120 tend to experience a lot of these symptoms. I do also like to reference ferritin, which is the iron storage, and that level should be ideally over 50. There are three common causes for why iron might be low. The most common reason that we think about is any form of blood loss. So this could be due to an acute injury, or it could be due to something like exercise or something called foot strike hemolysis. This is actually really common in runners, and we actually get a breakdown of red blood cells every time our foot hits the ground, and this can cause destruction of the red blood cells and a dropping of the iron. The other common reason that I see, especially in female patients, are heavy menstrual periods, especially if the periods are coming more frequently or are very heavy. There's a lot of loss coming with this. The two other reasons are going to be related to intake. So more commonly, in taking the iron that we have, there are two ways to do that. There's heme iron and there's non-heme iron. Heme iron is actually what's present in animal food, and it is more bioavailable and more absorbable. Non-heme iron is present in plant foods, things like spinach, things like legumes, and the iron is there, but it is more difficult for our body to extract and absorb the iron. The last reason, and actually I find this to be the most common reason, is issues with our digestive tract. If there is any inflammation in our gut, patients that typically get issues like constipation or bloating, this can actually affect the way that our body chooses to absorb minerals, including iron. And I really find that correcting the digestive tract. So iron supplementation is very commonly prescribed. I see this in a lot of my patients. Iron supplementation or even iron infusion can be really important, especially if there's an acute drop in iron and patients are feeling a big change in symptoms. So if they're getting a lot of anxiety or shortness of breath, it can help to correct the levels, and it can help to do it a lot faster. The issue with iron supplementation long-term, however, does cause some problems. Iron itself is a very unstable molecule, and it tends to cause more oxidative damage in the tissue, and it can break down the tissue over time, causing more health issues. The other thing is a lot of patients tend to experience more constipation from iron supplementation, which can further lead to issues with iron absorption. So I do really like to try to get iron up naturally through the diet and by correcting any of the underlying issues. So there are several ways that we can actually bring iron levels up. The first is to remove any type of acute blood loss. So in patients with heavy periods, for example, if there are any underlying issues of inflammation or estrogen dominance, which can also cause heavy periods, I really like to correct things internally and hormonally before we move on to correcting iron. Once the blood loss is corrected, the first thing we want to focus on is what's happening with the gut. First and foremost, removing a lot of the anti-nutrients from the diet. Anti-nutrients are plant compounds or plant chemicals, things like saponins, phytic acid, tannins, and these compounds actually bind minerals, including iron, and make it much harder for our body to absorb those minerals. So I do like to remove grains and legumes, at least temporarily, to see if we can get the absorption up. Secondarily, we want to prioritize heme iron, and this would be iron coming from red meat, so grass-fed beef, bison, elk, and also a secondary food that I find makes a huge difference is consumption of liver. Liver actually contains all of the cofactors we need to absorb iron. So those are things like copper, B vitamins, zinc, and they're in a very bioavailable form. So consumption of liver once a week, even 4 ounces, does make a huge difference in terms of bringing up the iron levels. The third thing that we want to look at is stomach acid. We produce hydrochloric acid, or HCl, from the stomach, and that plays a really important role in absorbing minerals. There are a few reasons why our stomach acid can actually drop. The first is actually due to our nervous system. So if we're in a really stressful state, we're not sleeping well, we've had some emotional stress, this can actually shut down the production of HCl in our gut. So I do find correcting the nervous system very important. We can actually also add in additional supplementation to help. So things like hydrochloric acid capsules or digestive bitters, both are very effective ways to bring up stomach acid to help then support the absorption of iron. And lastly, adding in vitamin C. So vitamin C can be supplemental, it can be through whole food form, things like lemon and water, or even adding tomato to your beef to increase the absorption of the iron into the gut. Iron takes about 2 to 3 months to recorrect, so I do recommend rechecking your levels every 3 months. Yes, so you can definitely have too much iron, and this is actually something that I see more commonly in men because they're not having regular bleeding every month. And I will see this typically in the form of high ferritin or elevated ferritin. Elevated ferritin can happen for a couple reasons. So there is a genetic condition called hemochromatosis where we store more iron in the body genetically. If that is not the case, and we can kind of check this genetically, often high ferritin can be a cause or a side effect of inflammation in the body. So we do want to figure out what is causing the inflammation, remove it, and generally when we do that, the iron levels will drop. Patients who consistently have high iron sometimes do feel better donating blood or giving blood, and they do feel a big difference in their mood and their energy.